السلام عليكم ورحمة الله وبركاته طلبة المرحلة الثالثة. اليوم تعتبر هاي العنوان الأخير أو المحاضرة الأخيرة في موضوع اللوكال أنستيزيا، واللي هو عنوانها anesthesia complications or complications of local anesthesia. In spite of careful patient evaluation, proper tissue preparation, and meticulous technique of administration, local and systemic complications associated with dental anesthesia may be developed sometimes. A written note should be entered into the patient's dental chart with any complication associated by the administration of local anesthesia. طبعا احنا هذا غير معمول به الآن عندنا في dental clinic، لكن في العيادات الخارجية، عيادات خارج العراق، يعتمدون مبدأ الكونسنت، إقرار المراجع أنه أنت تبدي بالعلاج ويتحمل النتائج التابعة لهذا العلاج. Complications, which means adverse events or sentinel events, are defined as unplanned, unexpected, unintended, and undesirable patient's outcome: death, physical, psychological injury, or any unexpected variation in a process or outcome that demands notice. الكومبليكيشنز هي الأعراض الأعراض الغير طبيعية اللي تطرأ نتيجة إعطاء اللوكال أنستيزيا دون قصد. هاي النقطة مهمة جدا. Errors are deviations from the accuracy or correctness. هنا الخطأ لا، هنا بقصد. Usually caused by a fault or mistake, as carelessness, misjudgment, or forgetfulness. يعني نتيجة نسيان، أو نتيجة قرار خاطئ، أو نتيجة إهمال ينتج عنه هذا الخطأ. أما الكومبليكيشن هو دون قصد ودون إهمال. الكومبليكيشنز of local anesthesia تنقسم إلى قسمين: local and systemic complications. اللوكال complications، أول complication ممكن إحنا نتعرض له هو failure of local anesthesia, needle breakage, prolonged anesthesia or paresthesia, facial nerve paralysis, trismus, soft tissue injury, hematoma, pain on injection, burning on injection, infection, edema, sloughing of tissue, post-anesthetic intraoral lesion, blanching, and visual problems. أول complication قلنا هو failure of local anesthesia، فشل في الحصول على التخدير. Failure of local anesthesia. Local anesthesia is not 100% successful in dentistry, and there are reasons for its failure. من هاي الأسباب هي anatomical، قد تكون تشريحية، pathological, pharmaceutical, or psychological or technical. طبعا أي فشل من يحدث أول علاج له هو شنو؟ لابد أنه تعيد التكنيك. So the first stage in dealing with failed administration is to repeat it. The failure of anesthesia could be anatomical causes. The anatomical causes of failure may be due to bony barriers, as مثلا اللينجولا تكون طويلة or large، فتمنع تسوي لك ما تمنع الاتاتشمنت of the needle. أو الزايجوما بالذات هاي تصير عندنا بالأبر 6. الزايجوما البطرس يكون عريض، ممكن تزعجنا بإعطاء الانفلتريشن للأبر 6. Variations in position of nerves and foramina، مثل ما ذكرنا من ممكن أحيانا يكون عندنا two mandibular foramen أو retromolar mandibular foramen، أو أحيانا يكون عندنا variation in the position of the mandibular foramen. So use a technique to overcome this problem like using of a kinusi or go gate technique, تعطي high technique to overcome the problem of an ectopic mandibular foramen. Collateral nerve supply. أحيانا أنت تعطي mandibular nerve block وبنفس الوقت يظل يتأذى المراجع, you have to give to the accessory, to the long buccal or to the mylohyoid nerve. مثلا بالماكسيلا greater palatine and nasopalatine nerves may contribute fibers to the pulp, فتعطي palatal injection in addition to the infiltration. And mandible block anesthesia is less likely to counter collateral supply compared with infiltration methods, which are normally used in maxilla. So additional fibers from episilateral inferior alveolar nerve, lingual nerve, long buccal, mylohyoid, auriculotemporal, or أحيانا from the cervical nerves. هاي الصورة توضح لنا الكولاترال يجي accessory innervation from other nerves to the molar region. لذلك احنا لازم تحط ببالك انه you give additional anesthesia. Fibers from the episilateral inferior alveolar nerve بهالحالة شو تسوي؟ تستعمل high block or high technique of anesthesia to overcome such variations. Pathological بالذات من يكون عندك abscess. The explanation is that the inflamed nerves are hyperalgesic. In other words, they transmit impulses under minimal stimulation. Pharmaceutical causes of failure. Improper storage may decrease the efficacy of the local anesthetic agent. Keeping cartridges at high temperature or in light directly to the light may lead to loss of its activity of epinephrine, which will decrease its effectiveness. The most likely cause of pharmacological failure is the injection of too small dose. This may explain why repeat injection often overcome the failure. Psychological causes of failure. Conscious sedation. يعني يجي لك المراجع شلون ما تضربه أوبرا يظل يتأذى، يظل يقول لك لا تأذاني. تستعمله تحوله إلى الناترس أوكسايد اللي هو نسميه conscious sedation. تستعمل وياه مضادات القلق anxiolytic agents, reducing needle phobia, producing muscle relaxant, overcoming gagging, producing analgesia. Technical causes of failure. The success of local anesthesia is a technique dependent. So خطأ من عندك، خطأ من مهارتك أنت بإعطاء الأنستيزيا. شو تسوي بالحالة؟ practice more، ظل تكرر عملية إعطاء الأنستيزيا. The choice of an appropriate alternative method، أو تختار طرق بديلة لإعطاء الأنستيزيا. So in case of failure of anesthesia in lower molars due to technical reasons, هذا يراويك الشارت how to overcome failure of anesthesia in order to get a proper or a success anesthesia of بالذات للlower jaw. Sorry. من الcomplications الأخرى الممكن تصير هي needle breakage. Since the introduction of a non-reusable stainless steel dental local anesthetic needles, needle breakage has become an extremely rare complication of dental local anesthetic injections. It could be يعني هذا needle breakage عادة يصير ويا gauge 30 اللي very fine diameter و short needles اللي احيانا الهب مالته يكون قريب فينكسر. دائما قلت لكم ينكسر النيدل من جهة الهب. ها هنا الصور يراوينا البوزيشن اوف نيدلز breakage needle. طبعا الكوزز هو ممكن مراجع يحوص يتحرك بسرعة، هذا يضوجك طبعا. unexpected movement of patient, multiple used of the needle, defective manufacturer خطأ صناعي بالنيدل, smaller gauge, intentional bending of needle by the doctor يعوجها زايد للنيدل, forceful contact with bone يتحرك ويا البون، يضرب النيدل ويطخ حركة ويا البون. هي الموضوع النزاكة وتعرف وين تشتغل. preventive measures شلون تتجاوز هالمشكلة هاي. not to use short needles for inferior epithelial nerve block in adults or larger children, not to insert the needle till the hub, not to use a 30 gauge needles for inferior epithelial nerve block, not to bend the needles when inserting them into soft tissue. Needle breakage is not a significant problem if the needle can be removed without surgical intervention. هي مو في المشكلة، إذا باقي الراس ما تقدر تجرها. Ready to access by hemostat. If difficult to grasp the broken instrument or the broken needle, you have to refer the patient to an appropriate specialist, for example, oral maxillofacial surgeon, for evaluation and the postmortem for retrieval. Conventional management involves locating a retained the fragment through panoramic X-ray or CT scan, and the surgeon in the operating theater then removes the retained needle while the patient is under general anesthesia. من المشاكل الأخرى الممكن تصير هي prolonged anesthesia. يجي لك المراجع يقول لك طول عندي التخدير 6 ساعات 8 ساعات 10 ساعات. Normal distribution of patient response to drugs allows for the rare individual who may experience prolonged soft tissue anesthesia after local anesthetic administration that persists for many hours longer than its expectance. Actually, this is not a problem. When the anesthesia persists, it is a persistent anesthesia or altered sensation well beyond the expected duration of anesthesia for days, weeks, or months. The potential for the development of a problem is increased. In addition, it includes hyperesthesia, dysesthesia, in which patient experience both pain and numbness. A patient's clinical response to this can be profuse and varied, including sensation of numbness, swelling, tingling, and itching. أحيانا يحس بها numbness يستمر لأيام وحكة بالمنطقة. Associated oral dysfunction and including tongue biting, drooling يرول بالسلايفة, loss of taste, speech impediment may be noted. The etiology of such causes of prolonged anesthesia, not due to damage of anesthesia. Contamination of the anesthetic solution with alcohol or some other germicidal solution. Needle trauma to the nerve tissue. Trauma and swelling of the soft tissue in proximity to the nerve trunk. Hemorrhage into or around the neural sheath is another cause. Bleeding increases pressure on the nerve fibers, leading to paresthesia. All local anesthetics may cause nerve injury. They are neurotoxic in nature. The occurrence of sensory impairment is apparently slightly more frequent following the use of articaine or prilocaine. Management. Most of the causes of such paresthesia resolve within 8 weeks of a maximum. Reassurance for the patient. Reschedule the patient for examination every 2 months as long as the sensory deficit is persistent. Dental treatment may continue, but avoid re-administration of the same local anesthesia into region of the previously traumatized nerve. The use of alternative local anesthetic technique is possible, if possible. Another complication هو facial nerve paralysis. The seventh cranial nerve carries motor impulses to the muscles of facial expression into the scalp and external ear and other structures. Paralysis of some of its terminal branches occurs whenever an infraorbital nerve block is administered or when maxillary canines are infiltrated. Muscle drop is also observed when occasionally motor fibers are anesthetized by an inadvertent deposition of local anesthesia into their vicinity. والحالة الأخرى هذا من تعطي infraorbital block in a high position أو تعطي بالكناين، وأحيانا إذا تعطي إذا تذكرون إذا نعطي الانفيرال نيرف بلوك نعطيه without touching ball وندخل كل النيدل بعد نوصل الباروتيد ريجن، من الممكن أحيانا تنتهي by anesthesia to the facial nerve. So the generalized facial nerve paralysis may occur when anesthetic is introduced deep into the deep lobe of the parotid gland, through which the terminal portions of the facial nerve extend. يطفى عند هاي الجهة رأسا تهطل المسلز، المراجع ما يعرف شلون يسد عيونه. أهم شيء إنه هنا تسوي reassurance for the patient، تطمن المراجع إنه الأمور okay under control، مجرد ينتهي وقت الأنستيزيا تنحل المشكلة. So the causes هي transient facial nerve paralysis is commonly caused by introduction of local anesthesia into the capsula of parotid gland, which is located at the posterior border of mandibular ramus, directing the needle posteriorly or inadvertently deflecting it in the posterior direction during inferior alveolar nerve block, or over-inserting during echinosis technique, may place the tip of the needle within the body of the parotid gland. If local anesthetic is deposited, transient paralysis can result, and the duration of the paralysis is equal to that of the soft tissue anesthesia usually noted for that drug. Management: within seconds to minutes after deposition of local anesthetic into the parotid gland, the patient senses weakening of muscles and of the affected side of face, and sensory anesthesia is not present in this situation. And management includes رأسا المراجع يقول لك دكتور شو بعد ما اقدر اسد عيني، شو ما اقدر احرك خدي. المانجمنت مالتك شلون تكون؟ reassurance of the patient, explain that the situation is transient and will last for a few hours and will resolve without residual effect. Contact lenses should be removed until muscular movement of returns اللي يلبسون عدسات اللاصقة. Any eye patch should be applied to the affected eye until the muscle tone returns. يعني هذا ما يقدر يسد عينه، فالأفضل إنه تلبسه مثل الكمادة حتى لا تتأذى عينه. Record the incident on the patient chart. Although no contraindication is known to re-anesthetize the patient to achieve mandibular anesthesia, it may be prudent forego further dental care is at this appointment. مو معنى هذا ما تقدر تسوي علاج إلى المراجع، لا بالعكس، كمل الدنتال مانجمنت مالتك وقل للمراجع روح وهي موضوع وقت وتنتهي. العفو. الكومبليكيشن الآخر ممكن يصير هو trismus is a prolonged tetanic spasm of the jaw muscles by which the normal opening of mouth is restricted، ما يقدر يفتح حلقة. Normal mouth opening ranges from من 35 إلى 45 ملم. Males usually have slightly greater mouth opening than females. The average interincisal opening in cases of trismus is about 40 mm. In most instances of trismus, the patient reports pain and some difficulty in opening of his mouth or her mouth on the day after the dental treatment. Usually it happens with a posterior superior alveolar nerve block, or more commonly with the inferior alveolar nerve block. Trismus is not always preventable. ما تقدر تمنعه. هو جزء من انت جزء من عندنا تسوي tearing الميديال pterygoid muscle in order to touch the mandibular foramen. It causes trauma to the muscles or blood vessels in the infratemporal fossa. Local anesthetic solution into which alcohol or cold sterilizing solution have diffused. نوبات يعقمون النيدل فهذا يسوي لك irritation لل surrounding tissue. Local anesthetic have been demonstrated to be slightly myotoxic to the skeletal muscles. Hemorrhage is another cause. ممكن يصير نزف within المصل. Low-grade infection after injection can also cause trismus. كأن تكون النيدل أو food debris بالpatient's mouth تسوي لك a low-grade fever or infection. Multiple needle penetrations. Every needle insertion produces some damage to the tissue through which it passes. Excessive volumes of local anesthetic solution deposited into the restricted area produce distension of the tissue, which may lead to post-injection trismus. ينتفخ التشيو، فمن الممكن هذا يسوي لك muscle fatigue، وبالتالي يصير عندنا ترسمس. مانجمنت هي المشكلة شلون تعالج الموضوع. Heat therapy لا بأس بعض المساج تسوي للاريا. Consists of applying hot moist towels to the affected area لمدة 20 دقيقة كل ساعة ساعتين. Warm saline rinses يتمضمض بالسلايم solution كل يعني فتكون ساعتين ثلاثة. The rinse is held in the mouth on the involved side and spit it. يسوي مثل تعقيم للاريا. Analgesic if necessary muscle relaxant myogesic ومشاكل. Physiotherapy المساج هنا كلش مفيد. Opening and closing of the mouth as well as lateral exclusions of the mandible for 5 minutes every 3 to 4 hours. يعني يحرك فتشة يمين يسار، ولا بأس يستعمل العلج كتمرين للعضلات. الأذر complication وهذا بالذات يصير مع children هو soft tissue injury. Self-inflicted trauma to the lips and tongue is frequently caused by the patient inadvertently biting or chewing these tissues while still anesthetized. مثلا مراجع جوعان أكل نبات يعض لسانه وهو ما يدري، يعض شفته ما يدري. Trauma to the anesthetized tissue can lead to swelling and significant pain when the anesthetic effects resolve. ورا ما ينتهي المفعول الانستيزيا يبدي المراجع يحس بألم. الكوز trauma occurs most frequently in younger children and in mentally and physically disabled children or adults, and in older patients. However, it can and does occur in patients of all ages. ممكن تحدث في كل الأعمار الأخرى. Dental patients receiving local anesthetic during their treatment usually are dismissed from the dental office with a residual soft tissue numbness. فلذلك من الممكن إذا أكل بالغلط يقرض لسانه أو يقرض شفته، فهذا يسموها post anesthetic trauma. شلون نمنعها إذا نحس إنه هذا المراجع ممكن إلى القابلية old patient, disabled patient. warn the patient، تحاول تحذره or their his guardian وياه المسؤولين عنه against eating, drinking hot fluids and biting on the lips or tongue that have the anesthesia. Local anesthetic of appropriate duration should be selected if dental appointments are brief. Cotton roll can be placed between the lips and the teeth if they are still anesthetized at the time of discharge. The cotton roll is secured with dental floss ويا الأسنان يربطوها wrapped around the teeth to prevent inadvertent aspiration of the roll. A self-adherent warning of stickers ممكن يحطوا لهم لزقات انه يقولون يابا هذول مبلجين may be used on children حتى تحذر الاهالي او تذكر الاهالي انه هذول عندهم هيك مشاكل او هو تحت التخدير الاسنان. المانجمنت it is symptomatic تقدر تعطي analgesic for pain removal, antibiotics to prevent further infection, warm saline يتمضمض بالمغذي normal saline. ممكن تحط gel vaseline lubricant to cover the lip lesion and minimize its irritation. الأذر complication هو الهيماتوما and ecchymosis. هاي تصير طبعا بالذات نوبات من تدخل النيدل زايد. A hematoma rarely produce significant problems aside from the resulting bruise which may or may not be visible extraorally. Possible complications of hematoma include tenesmus and pain. Swelling and discoloration of the region usually subside gradually over 7 to 14 days. Hematoma that occur after the inferior alveolar nerve block usually are only visible intraorally. For the inferior alveolar nerve block تكون intraorally. Whereas for the posterior superior alveolar nerve it's visible extraorally. When the blood effusion during hematoma formation is stopped, the blood effuses from the vessel until extravascular exceeds intravascular pressure or until clotting occurs. يظل يطلع blood إلى أن الإكسترافاسكولار بريشر يغطي أو يضغط على الفزل فيوقف البلاد أو يصير كلوت وهاي الكلوت هي تسد الرابتشرد أو الانجرد فزل. Causes inadvertent or nicking of blood vessels during administration of local anesthesia تضربة للفزل. Tissue density surrounding the injured vessel is a determining factor. The denser the surrounding tissue, for example the palate, the less likely hematoma is to develop. But it is more happen in looser tissue as in infratemporal fossa. هاي الصور للهيماتوما والإكيموسيس الطقع الممكن تصير after giving injection. البريفنشن hematoma is not always preventable ما تقدر تمنعها. Whenever a needle is inserted in tissue, the risk of inadvertent puncture of blood vessel is present. Knowledge شلون تقدر هاي كل ما أنت تتعلم الطريقة التكنيك السوفت والسريع اللي ممكن نعطيه للمراجع. So knowledge of normal anatomy for proper technique. The number of needle penetration should be as low as possible and discard the defective needle. مو ظل تستعمل نفس المستعمل لأن هاي قلنا تنعمي راس النيدل وبالتالي تسوي لنا مور تروما. المانجمنت directly apply pressure over the site for a few minutes. لا بأس باستعمال الآيس باك. Then after 8 hours you can use hot pack. Prescribe analgesic, antibiotic and muscle relaxant. With or without treatment, hematoma will subside within 7 to 14 days. الأذر complication هو الpain during injection. الpain at the time of injection is mainly due to poor technique or may be caused by the following. Intraepithelial injection. أنت ما تدخل النيدل زايد بقية بالميوكس membrane. This causes epithelial ballooning and is overcome by the insertion of the needle into the submucosa. Subperiosteal injection. تضخ البون وتزرق الانجكشن الانستيزيا هناك فحتكون مؤلمة. This is discomfort due to injection into a non-compliant tissue. Too rapid injection rate. A slow rate of injection reduces discomfort. Direct contact with the nerve trunk during block anesthesia, and this could occur with even experienced operator. العوامل الأخرى تؤدي إلى pain during injection هو factors related to the solution. The presence اللي هي pH الحامضية. The presence of adrenaline increase the injection sensation due to the low pH. Temperature, cold solution less than 50 degrees centigrade cause pain. لذلك أنا دائما أفضل لما الجو بارد واحد يدفيه براحة إيده. And should be allowed to reach the room temperature before injection or hot one. السبب الآخر هو a needle can become dull from multiple injections. العفو هاي هنا النقطة المفروض تكون number 6 وليس number 7. So هنا number 6 sorry. A needle multiple penetration of the needle. Burning شعور بالحرقة during injection. هذا عكس الpain. Burning sensation. The primary cause of a mild burning sensation is the pH of the solution being deposited into the soft tissue. The pH of a plain local anesthesia is approximately 6.5, whereas containing vasopressor is about 3.5. A rapid injection of local anesthetic, especially in the denser, more adherent tissues of the palate, produces burning sensation. Contamination of local anesthetic cartridge can result when they are stored in alcohol or other sterilizing solution, leading to diffusion of this solution to the cartridge. Solutions warmed to normal body temperature usually are considered too hot by the patient. Another complication هو infection. Infection subsequent to local anesthetic administration in dentistry is extremely rare. ليش؟ لأن نستعمل sterile disposable needles. The causes of infection. The major cause of post-injection infection is contamination of the needle, تلوثها, before administration of the anesthetic solution. Contamination of a needle always occurs when the needle touches mucous membrane in the oral cavity. Or another cause was improper technique in the handling of local anesthetic equipment or improper tissue preparation for injection are another possible causes of infection. Prevention of infection هو use of sterile disposable needles, proper care for and handling of the needles, care and handle the dental cartridge of local anesthesia, use a cartridge only once for one patient, movement patient and patient, store cartridges especially in the original container, cleans the diaphragm with a sterile disposable alcohol wipe, properly prepare the tissue before penetration. Management. Low-grade infection, which is rare, is seldom recognized immediately. The patient usually reports post-injection pain and dysfunction for 1 or more days after dental care. Immediate treatment consists of those procedures used to manage trismus, تعطي analgesic, muscle relaxant, antibiotics, physiotherapy، كلها تساعد على تخفيف low grade infection. After 3 days, if trismus non-resolved, the patient started on 7 to 10 days course of antibiotics. لأن عادة الانفكشن يصاحبه نوع من الترسمس of difficulty in opening his mouth or her mouth. من المشاكل الأخرى تصير هو الانتفاخات أو edema. Swelling of tissue is not a syndrome, but it is a clinical sign of the presence of some disorders. Causes of edema: trauma during injection, infection, allergy. Angioedema is possible response to ester type of local anesthetic agents. Hemorrhage: fusion of blood into soft tissue produces swelling. Injection of irritating solution, alcohol or cold sterilizing solution containing in cartridges. نوبات أحيانا هاي مو يعقموا بالالكحول، نوبات تختلط بيها أو يصير diffusion of such solution للكارتريج فتسبب انتفاخ أو swelling post-operatively. The management of such edema or swelling, the management of edema is predicated on reduction of the swelling as quickly as possible and dealing with the causes of edema. It may be necessary to prescribe analgesics for pain removal. Allergy-induced edema is potentially life-threatening. Its degree and location are hardly significant. If swelling develops in buccal soft tissues and there is absolutely no airway involvement, treatment consists of intramuscular and oral histamine blockers and administration. Consultation with a physician to determine the precise cause of edema. Sloughing of soft tissue, other complication. ينسلخ soft tissue. Prolonged irritation or ischemia of gingival tissues may lead to a number of unpleasant complications, including epithelial discrimination, خلع للأبيثيليا, and sterile abscess. قرحة ممكن يصير ulceration. Causes of epithelial discrimination هو application of topical anesthesia to the gingival tissue for a prolonged period and heightened sensitivity of tissue to either topical or injectable local anesthesia. Sensitivity, allergy. A sterile abscess secondary to prolonged ischemia resulting from the use of local anesthetic agent with a vasoconstrictor, usually norepinephrine, and usually appear on the hard palate. In management, no formal management is necessary for epithelial discrimination or or sterile abscess. Reassurance for your patient. Management may be symptomatic for pain, aspirin or other non-steroidal analgesic, and topical applied ointment are recommended. Epithelial discrimination resolves within a few days, and the course of a sterile abscess may run within 7 to 10 days. الأذر كوز هو post anesthetic intraoral lesions. من الممكن يصير عنده قرحة، من الممكن يصير عنده red patches. Patients occasionally report that approximately 2 days after an intraoral injection of local anesthesia, ulceration developed in their mouth, primarily around the site of injection. The primary initial symptom is pain and usually of relatively intense in nature. ممكن تظهر هاي الأمور after giving of injection. الcauses: recurrent after stomatitis or herpes simplex can occur intraorally after local anesthetic injection or after any trauma to the intraoral tissue. Recurrent after stomatitis is more frequently observed than herpes simplex, typically developing on gingival tissue that are not attached to the underlying bone, such as buccal vestibule. In spite of much containing research, the causes remain poorly understood, and the ulcers are not preventable, and treatment remains symptomatic. Trauma to the tissue by a needle or local anesthetic solution or a cotton swab or any other instruments like rubber dam, handpieces may activate the latent form of a disease process that was present in the tissue before injection. أكو نبات hidden viruses by reduction of immunity، وعندك site of trauma by the injection من الممكن يصير herpes infections. Primary management is symptomatic. Reassurance for your patient, topical anesthetic solution, lubricant agents, Kinalog, Inorobase, intraoral steroid ointments, even some analgesic can be given to the patient. Another cause or other complication هو blanching, tissue blanching يبيض مكان الانجكشن. الcauses مالته trauma to blood vessel by a needle, intravenous administration of local anesthesia, interference with autonomic nerve supply of the blood vessels. شلون تتجاوز هالأمور هاي؟ شلون to prevent it، تقي نفسك من عندها by aspiration and avoiding intra-arterial administration. Management is it transient. By the end of the effect of anesthesia حينتهي الموضوع and no treatment is required. من الممكن أحيانا تصير وهي بالذات بالبلوك انجكشن وبالذات بالانفيرال بلوك انجكشن من تعطيها in a higher position يصير عنده visual disturbances as squint يحول or diplopia تزدوج عنده الرؤية. Diplopia or double vision infiltrating into the orbit to the anesthetic extrinsic ocular muscle of the eye. سوري هاي هنا خطأ، هي eye مو yes، المفروض تنكتب intra-arterial injection بالذات بالهاي تكنيك of inferior alveolar nerve ممكن يصعد through foramen ovale or foramen spinosum. Non-management is required. It will resolve by the end of the effect of the anesthesia. Transient squint or a double vision also. Paralysis of the extra-ocular muscles of the eye. Diffuse into the orbit by the pterygopalatine fissure and ganglion and infratemporal fossa, affecting the oculomotor and trochlear and abducent nerve. Also, no treatment is required, just reassurance for your patient. نوصل إلى systemic complication ونكملها إن شاء الله بكرة إن شاء الله، حتى على الميتينج يوم الأحد نغطي كل ال complications of local anesthesia. شكرا جزيلا وبارك الله بكم.